Hi, I'm Jennifer Ernst. I'm the CEO of Tivic Health. I am not Heather Viren, as it says on the screen, so you'll just have to trust me on that. So actually, we were here a few years back. I was very honored at the time to be the recipient of one of the most promising startups in bioelectronics. And the biggest news since last time we were here is, as of November, we IPO'd. So if I still count as an entrepreneur, we're now also a publicly listed company. Which means that I get to put up the forward-looking statements document. Please read that carefully before I proceed.
We've been looking forward to that.
Okay. Just very quickly, actually, I'm using our investor deck, but I will skip through most of the things you probably don't care about and touch on a few that you will. Actually, you're getting a preview. Today, we are announcing a couple of new executive hires, including our Chief Financial Officer, who is coming to us from Catalyst Bioscience, Reflection. And also, you'll notice my Chief Operations Officer, who was recently named to that post, who brings an incredible consumer background. The reason I mention those is because we are actually forging a business model that merges the best of consumer electronics and consumer marketing approaches with medical device. And for those that are forging this pathway with us, I strongly encourage you to consider that you don't do it without experienced consumer marketing on board. So what do? We're focused on immune system responses, and we have started with a first commercial product for sinus health, treating sinus inflammation with a neuromodulation or bioelectronic device that is used only on the outside of the sinus passages. And so you see the little device here. User glides it around the tissue around the sinuses in the cheek, the nose, the brow bone area. FDA approved, CE marked. We're selling online. Over 30,000 units sold at this point, and 1.2 million in revenue last year. So I don't need to go through this with you, but this is usually part of my investor deck, is to talk about, because we still actually do have an education out there in the world at large that electronic medicine is not snake oil, that there is actually a fundamental electronic system at work in the body, and we're finding all sorts of ways to harvest it. That last presentation just points to all of the different ways this can have effect. This is also a slide I use to talk about something I don't usually hear, but heard here today quite a bit, is the move from implanted to non-invasive technologies. That fourth bullet down there is actually the one I wanted to focus on, because as we move to non-invasive technologies, it really does open up that opportunity for us to have first-line therapeutics. And I know that this is heresy. And I should not be doing this one on my, but I wanted to share with you that this is WebMD. And despite the fact that we're an advertiser on the right-hand side of the page, I also want to point out to you that WebMD itself now has pointing out to a microcurrent device. Of course, they've simplified it to say it's vibration that does the treatment instead of the electrocurrent, but that is actually a direct reference to our product. So it is possible to actually start penetrating that front line of the commercial side. So that's our product in use. It's a first commercial product, available on Amazon, Walmart, Best Buy, Walgreens. For the record, anybody else forging this course, don't do business with Walgreens. Just don't. They lose inventory, they don't pay, just don't. So with the IPO, we actually decided to focus very heavily on the online channels that we control, which are Amazon, our Walmart presence, and our website, as well as we're developing a very strong relationship with Best Buy. Nothing unusual to this audience. The key to the technology is a set of proprietary algorithms that act, as we were describing earlier, a little like a stud finder for nerves and blood vessels. We have programmable parameters that we're harvesting to be able to change the current and the frequency output. And the form factor itself allows the current to penetrate very deep into the tissue at extremely low current levels. So most people don't even feel the current when it passes through the skin, or they feel a little tick or a little tingle of something. So we have, I just realized I hadn't updated my slide, but we just recently started a study with Mount Sinai, the Icahn School of Medicine at Mount Sinai, on the use of this technology as an alternative for fentanyl or excuse me, as an alternative following sinus surgeries. So the pain, post-operative pain procedures. Also, there's a great deal of overlap between migraine and sinus treatment. So we are investigating the utility of this in migraine, specifically because our customers are already telling us that it's helping them to relieve their migraines. So an extensible platform, variable parameters, multiple clearances, multiple intellectual property, multiple peer-reviewed publications. In this particular segment, OTC dominates the sinus care market. So I get asked, well, what about reimbursement? What about this? I mean, we've heard it, you guys understand it here. That is a painful pathway to go down. We're 3 years into the market and we're at 1.2 million of revenue. That's just having done it on almost no capital funding whatsoever. So now that we actually have capital in the bank, being able to do 2x, 3x, 4x, 5x growth is merely a matter of funding. And we have access to the public markets, which, yes, venture capital is a lovely source, but the number of investors in the public market who are willing to invest in liquid stocks dwarfs venture capital. So one thing though about our current core market that surprises people, flushing our noses with salt water is a $700 million a year business, just here in the US. Okay? Who said that's crazy? That's exactly. So I still, every time I present this, I can't get over that number. In terms of why people are buying our product, these are the things they're telling us. It's very fast acting. Our clinical studies have proven that out. The benefits increase with regular use. So it's not uncommon for people to say, I used it for a few weeks. I've weaned myself off medications. I'm not using any of my drugs. So there's no pills or sprays, nothing that goes up the nose. It's a big deal for this group. Imagine sinus treatment and sinus care with nothing invasive. There's no significant side effects. So we have a little reddening of the skin that gets reported in 0.02% of our population of users. And the fact that there's no limitations on the use. So one of the things we really focused on as a company is building out the value proposition that matters to our end user, to the consumer. Going really directly to that person who has the problem and building for them. The great thing about talking about sinus care is I don't have to tell you it's a huge market. Those products I put up there earlier, probably everyone in the room has some of them in your drug cabinet. So great market penetration at 1 million of revenue. We barely scratched the surface. So significant growth opportunity in our core market. This is one of the big things though that I think is important. And this number is actually from a few years ago, where 74% of our target customers expected to purchase the product online. That is a golden opportunity. So we've set up the infrastructure. I've got the right skill set in place. We've got the right team in place for building out that online infrastructure, that online distribution system, the 3PLs, the manufacturing partnerships, everything that's needed to really optimize and drive the sales. So last year's number, 1.2 million of revenue, 600,000 in advertising. That's without any real optimization on top of our program. So those are numbers, again, when you get it right in consumer, it's like printing money. So tried and true, this kind of approach is very common in consumer products. Able to generate awareness through our social campaigns like you saw on the WebMD page there. Building credibility through repeat exposures and driving purchase. So our 2022 directions, I'm going to highlight one of these because I consider everybody in this room a scout for us. We are expanding our sales and marketing. I've got work on improving our gross margin and expanding the number of indications and variants around the initial product. We are conducting additional clinical research to extend the applications around the core technology. And then we are evaluating potential merger, acquisition, and licensing opportunities. So there are certain types of technologies or certain diseases that are particularly amenable to this direct-to-consumer model. particularly anything where change your behavior is the first line of therapy. So with the public market platform behind us, we now are working on building out that platform. And I would invite anybody who has ideas about things that might be good or would like to talk, certainly a conversation we're open to having. And then that last piece of it is that, we really are looking to build Tivic up as a brand that has a presence in bioelectronic medicine well beyond our first core offering. So that's Tivic. I'm happy to take any questions.